All right, so let's start with the big story that we are tracking on WION at this hour, where Indonesia has recorded over 500,000 cases of COVID-19 infections as stores remain shuttered and markets continue to experience very little footfall. The country remains one of the worst affected regions in Southeast Asia due to the COVID-19 infections, with the capital city of Jakarta being one of the worst affected cities. In Jakarta, where relatively loose social restrictions have been in place until the 6th of December. People, of course, met this grim milestone with a glum resignation, feeling that more restrictions could in fact come about in the next few weeks.
Kalau menurut saya mungkin pemerintah juga kurang serius, ya kan. Terus masyarakatnya juga udah jenuh kayaknya gitu kan dengan COVID ini. Jadi orang sekarang udah kayak gimana lah. Pasar udah keadaan sepi gitu yang belanja, jadi makanya orang udah kayak ini,
Terdampaknya ya ekonomi kita makin merosot, dari daya jual beli juga sangat jauh, 90% hilang kita ya. Karena orang kan di hawanya ketakutan, gimana ya, jadi kita mau usaha apapun sekarang jalan buntu. Dibilang ekonomi Indonesia merosot, ya 100% merosot.
Now, even as COVID-19 infections continue to surge in the country, Indonesia has been struggling to contain the spread of the virus since the very first cases were reported in the month of March. Now, with the daily infections hitting a record high and hospitals under a lot of pressure, the country is staring at a possible catastrophe. However, health experts say that shortfalls in testing and contact tracing and also consistently a high positivity rate indicate that the real numbers are likely to be significantly higher. All right, now to give us the insights in terms of what is actually happening in Indonesia, we are joined in by Devianti Faris, who is a journalist based out of Jakarta, and she's joining us live on this broadcast on WION. Devianti, thank you very much indeed for joining us here, and let me begin by asking you, how bad is the situation really in Indonesia? Because Indonesia is now being described as the nation with the worst outbreak of the COVID-19 pandemic in Southeast Asia.
The situation in Indonesia is quite grim. The spread of COVID-19 is still very widespread. Indonesia is still riding its first wave of COVID-19 ever since the beginning of the pandemic here in Indonesia in March. Now, there have been over 500,000 people, that's 500,000 people positive with COVID-19. The death toll has reached 16,000. And the only good news is that the number of people who have recovered from COVID-19 has increased, and it's reached over 422,000. Now, Jakarta, the capital, is the hardest hit city in the country, and it just recently extended its transitional period of large-scale restrictions for another 2 weeks up until the 6th of December. Just recently, last Saturday, Jakarta recorded the highest single-day jump of 1,579 cases. Now, recently, the University of Indonesia, a state-owned university, issued a report, and it states that public health compliance of COVID-19 health protocols is in the decline now by almost 10%. And that includes hand washing, physical distancing, as well as wearing masks.
Right.
The number of people that are basically following the health protocols are, for example, mask wearing is around 65%, hand washing is at 70%, physical distancing is at 40%. Now, the rate of public compliance with health protocols needs to reach 80% to effectively suppress the spread of COVID-19. And Jakarta has been in the spotlight recently because tens of thousands of people had gathered to welcome a firebrand cleric who had returned to Indonesia after self-exile from Saudi Arabia. That was a new cluster, and that's a cause of concern for many people.
Absolutely, indeed. And also now there is talk of the possibility of a vaccine that is just around the corner. Different governments in the world are placing their orders so that when the vaccines are being rolled out, their share of the vaccines is guaranteed. At this point of time, do we know of what steps the Indonesian government is taking to ensure that when the vaccine becomes available, it becomes available for the people in Indonesia?
Well, we all know that Pfizer and Moderna are ready for vaccines being distributed around the world, but Indonesia is unlikely to buy COVID-19 vaccines from either of them because it requires the vaccine to be stored in very, very cold temperatures. Now, the government would need to spend additional funding to overhaul its cold chain distribution network to handle storing vaccines in -20 to -70 degrees Celsius. Now, that's very difficult to do considering Indonesia is an archipelago. And Indonesia's local pharmaceutical company, Biopharma, is involved with China's Sinovac in its third stage clinical trials. The results haven't been issued and haven't been announced yet, but a lot of people are positive and very positive thinking with this vaccine. Once the vaccine is ready, it has to get the approval of the Food and Drug Control Agency before it's distributed to the community. Now, the Sinovac vaccine will obtain emergency use authorization by the end of January. The government will need to buy 236 or 107 million people will be vaccinated. They would have to buy 236 million vaccines. The government will buy 32 million for the poor and those working in the front lines of health workers, but the rest will have to buy the vaccines from their own pockets. But there are plans for the government to make the prices more affordable.
Absolutely, indeed. We'll have to leave it there. Thank you very much indeed, Devianti Faris, for joining us all the way from Jakarta and getting us all those updates in terms of what is happening in Indonesia on the COVID-19 front.